As a carer, you might notice that someone doesn't seem to be quite themselves, and you may be worried that they are becoming ill. Sometimes it can be obvious that someone is unwell if, for example, they are in pain or become very muddled or anxious. Other times, the signs might be much harder to spot and more vague. Soft signs are the early signs that someone might be becoming unwell. You do not have to be a nurse or doctor to recognise these signs. Often families or carers will pick up on the small changes in a person's behaviour or the way they look. Different people have different soft signs, and families will often be able to say what they are for their loved one. Examples of soft signs when someone is unwell could include being short of breath, not weeing as much, or being unsteady when walking. Other examples of soft signs could be changes in someone's behaviour, such as being much more anxious or agitated than normal, or being unusually quiet and subdued. Other soft signs include changes in the way someone sleeps. They might not want to get up in the mornings, or they might be very restless and not want to go to bed. Some people become very irritable when they don't feel right. It is good practice to ask the people you care for, "How are you feeling today?" Allow them time to answer the question in their own way. When you know someone you care for well, you will often know the signs that they are becoming unwell. As some soft signs may be very individual to that person, and it is worth letting other carers know how to recognise when someone is unwell. Perhaps it could be written down in a care record. Recognising soft signs is particularly useful for people who have difficulty communicating or understanding information, such as people with a learning disability. Imagine you look after Joe, a 20-year-old man who has learning disabilities and finds it difficult to say how he is feeling, but is always really friendly and smiling at everyone. You can never miss Joe when he is in the room. Unfortunately, Joe often gets bad chest infections. You know that whenever he is developing a chest infection, Joe becomes very quiet and wants to lie on the sofa. Therefore, his soft sign is being very serious and unusually quiet. As a carer, you will often know the soft signs for someone you love and look after, so trust your instincts and tell someone you are worried.